Hello friends, welcome back to my channel Nursing Guru 24. Today we will solve some high yield MCQs from respiratory system, and these MCQs are asked in previous exams. Let us start with first MCQ. A patient's EBG results show a pH of 7.30, PaCO2, that is partial pressure of carbon dioxide, is 52 mm of Hg. Then bicarbonate is 24 milliequivalent per liter. Then which acid base imbalance is this patient experiencing? See, this question is related to ABG. What are the components of ABG? Hope you all know. The components of ABG are pH, then partial pressure of carbon dioxide, that is PaCO2, then bicarbonate, that is HCO3, then partial pressure of oxygen, then oxygen saturation, that is SaO2. See, what are the normal values of these components? Normal pH of blood is 7.35 to 7.45. The normal value of PaCO2 is, see this, 35 to 45. PaCO2 normal value is 35 to 45 mm of Hg. Then bicarbonate's value is 22 to 26 milliequivalent per liter. Then PaO2 is 75 to 100 mm of Hg. Then SaO2 is 95 to 100%. See, in given MCQ, pH is 7.30, PaCO2 is 52 mm of Hg, and bicarbonate is 24 milliequivalent per liter. See here, if pH is more than 7.45, if pH is more than 7.45, then that condition is called as alkalosis. If pH is less than 7.35, then that condition is called as acidosis. Then PaCO2, if it varies, that condition is related to respiration, that is lungs. And bicarbonate, this component is related to kidneys. See, in given question, bicarbonate is normal, right? That is 24. Here the normal value is 20 to 26. Hence this condition is not related to kidney. Then PaCO2 is more than normal value, that is 45 mm of Hg. Hence this condition is related to respiration. Either this may be correct or this may be correct. We don't know. We will decide based on pH. Then pH is also abnormal, that is, here they have given 7.30, but the normal is 7.35 to 7.45. That means the given pH is less than normal value, that is 7.30, that is less than 7.35. Hence this is acidosis. Then here acidosis. Hence the correct answer is respiratory acidosis. This is not alkalosis because pH is less than 7.35 and PaCO2, that is a respiratory component, is more than normal. Hence this is related to respiratory acidosis, not respiratory alkalosis or metabolic. If there is bicarbonate is more than 26 milliequivalent per liter, then that condition would be metabolic, either alkalosis or acidosis based on pH. But here in given question, it is acidosis one. Hope you understood. Next we will move on to second MCQ. Which of the following is the most characteristic clinical finding in a patient with chronic obstructive pulmonary disease, that is COPD? In state level exams they may ask expand COPD or what is the long form of COPD, like this. Here what they have asked, what is the most common characteristic clinical finding of patients with COPD? See, here the correct answer is barrel chest, because what happens in COPD? In COPD, you people have heard about alveoli. These are alveoli. What alveoli will do? In alveoli, there will be exchange of gases. Carbon dioxide leaves the lungs, oxygen comes into the lungs. In case of COPD, there will be loss of elasticity of walls of alveoli. These walls of alveoli lose their elasticity and they are unable to perform their function, that is exchange of gases. Hence, partial exchange of gases will be there. Most of the oxygen will not enter the lungs and the utilized carbon dioxide will remain in lungs only. Because of that, lungs will expand. That looks like barrel chest, that looks like expanded chest, that looks like round chest. Hence, barrel chest is the right answer. Okay, next we will move on to third MCQ. A nurse is caring for a patient with a chest tube. The nurse notices continuous bubbling in the water seal chamber. This is mostly likely indicates what it indicates. Here there is a patient with intercostal drainage tube, ICD tube. Here the nurse notices there is continuous bubbling in the water seal chamber. What it indicates? Options are: the system is functionally normal, the patient has large pneumothorax, or there is an air leak in the system, or the suction is too high. See, intermittent bubbling is normal in patients with ICD. Intermittent bubbling in water seal chamber is somewhat normal or common in patients with ICD, intercostal drainage. But if there is presence of continuous bubbling in the water seal chamber, indicates there is air leak in the system. If there is air leak in the system, there will be continuous bubbles in the water seal. If there is intermittent bubbling, no need to worry. The tube is in correct position. There is no leak in the system. Hence, the correct answer is air leak in the system. Air leak. If there is air leak, there will be continuous bubbling in the water seal chamber. Next MCQ is, what is the gold standard? This is the keyword. What is the gold standard diagnostic test for confirming pulmonary embolism? What is the gold standard diagnostic test for confirming pulmonary embolism? Before seeing the options, we will see the meaning of pulmonary embolism. What is pulmonary embolism? PE. Pulmonary embolism means presence of blood clot in pulmonary artery. Clots in pulmonary artery. That is called as pulmonary embolism. That clots may block the pulmonary artery. Clots in the pulmonary artery. How can we diagnose these clots in pulmonary artery? That is the question. First one, here they have given D-dimer test. Usually D-dimer test is done to know the clots it doesn't detect the pulmonary embolism. Hence, this is wrong. Then chest X-ray. Most of the times what happens, chest X-ray will be normal even though there is presence of pulmonary embolism. Chest X-ray will be normal even though there is presence of clots in the pulmonary artery. Hence, this option is also wrong. And then arterial blood gas. This is also wrong answer, because arterial blood gas is done when there is respiratory distress, not in case of pulmonary embolism. When there is respiratory distress, at that time we will do ABG to know the acid-base balance. Then last option is CT pulmonary angiography. This is the correct answer. CT pulmonary angiography. Here technician will insert an catheter and he will detect the presence of clot in the pulmonary artery. That is the gold standard diagnostic test for pulmonary embolism. Next, fifth MCQ. During the suctioning of an endotracheal tube, the nurse should limit the suctioning time to a maximum. That means, what is the maximum duration for suctioning of ET tube, that is endotracheal tube? 5 seconds, 10 to 15 seconds, 20 to 25 seconds, then 30 seconds. See, if you are doing suctioning for less than 5 seconds, what happens? The completely secretions are not removed. This time is not sufficient for complete suctioning. Then 10 to 15 seconds. This is the correct answer, because doing suctioning for 10 to 15 seconds completely removes the secretions. We should not do more than 15 seconds, because keep these 2 points in mind. Suctioning should not be done more than 15 seconds, because it may cause hypoxia, or if you are doing more than 50 seconds, that may stimulate vagus nerve. What happens when vagus nerve is stimulated? It may cause bradycardia, or it may cause hypotension. To preventing bradycardia and hypotension, to preventing the stimulation of vagus nerve, we should not do suctioning more than 15 seconds. And this is wrong. If you are doing less than 5 seconds, again there will be no correct secretions removed. Hence 10 to 15 seconds is the correct answer. Next MCQ is, which position is most appropriate? This is again keyword for MCQ. Which position is most appropriate for a patient experiencing acute respiratory distress? That means, which position is suitable for the patient who is experiencing respiratory distress? Here they have given supine position, lithotomy position, high followers position, Trundle-Burr position. Supine position. What happens if we give supine position? See, this is the supine position. If you are giving supine position, the abdominal organs which are here, they push the diaphragm here. Because of this pressure, lungs will not get sufficient space for expansion. Lungs will not get sufficient for expansion because of this pressure. The room size will be less here, hence they will not get space for sufficient expansion. Hence supine position is not given in respiratory distress. Then lithotomy position is given in during childbirth or during vaginal examinations and all. And this is wrong answer. Then high followers or orthopneic position. What is orthopneic or high followers position? Here the patient or that person is made to sit at 60 to 90 degree. means like 60 or 90 degree. The patient will be made to sit at 60 to 90 degrees Celsius, 90 degree, hence he can take breaths very easily. This position is also called as orthopneic position, hence this option is right answer. At 60 to 90 degree angle, the patient can breathe very easily because abdominal organs go down, diaphragm also go down, hence the patient, hence the lungs will get more space for expansion. Hence, there will be normal breathing or ease of breathing. Then Trendelenburg, what is Trendelenburg position? Here head will be low and there will be foots will be somewhat upper side, that is foot and elevation will be there, head end will be lower side, like this. Again it will cause pressure over the lungs because of abdominal organs and diaphragm. Here the correct answer is orthopneic position. Hope you people are understanding. If you are liking this video, please like, share, and more important, subscribe my channel. Next we will move on to 7th MCQ. In a patient with tuberculosis, the Mantox test is considered positive if the induration is. In a patient with tuberculosis, the Mantox test is considered positive if the induration is. Before seeing these options, what is the Mantox test? This test is done to diagnose the tuberculosis. Then what we will use in this test? In this test we use, I think you people have heard about PPD. What is PPD? What is PPD? What is the route of giving PPD? Then what is the dose of PPD? I need answer for these questions in comment box. See here, a patient is there with tuberculosis, and in tuberculosis if we are giving PPD, when we will consider that as positive? Here they have given more than 2 mm, more than 5 mm in a healthy individual, more than 10 mm in a healthcare worker, redness without swelling. Before proceeding with these options, what is the meaning of induration? What is induration? Induration means hard swelling of skin, but there will be no redness. Only hard swelling will be there, but there will be no redness. That is induration. Induration occurs if the patient is positive for TB. Here they have given more than 2 mm. This is normal one. In normal individuals also, it may or the induration may be 2 mm. This is normal one, that indicates negative for TB. Then more than 5 mm in a healthy individual. This is also wrong answer, because more than 5 mm in a healthy individual is not expected if there is presence of TB. That if there is 5 mm induration, that is normal one, that indicates a negative for TB. Then redness without swelling. Just now only I told there will be only hard swelling, no redness. Hence this is also wrong. Hence more than 10 mm in a healthcare worker or more than 5 mm in immunocompromised people like HIV or TB or diabetics, etc. In such cases, even more than 5 mm induration is considered as positive for TB. See, in immunocompromised people, more than 5 mm is considered as tuberculosis. Here they have given more than 10 mm in healthcare worker. Healthcare in the means they are high risk people. Hence, this is the right answer. Next, we will see 8th MCQ, that is, which breath sound is specifically associated with the narrowing of the lower airways as seen in asthma? Following which breath sounds are associated with asthma? That means because of narrowing of lower airways, which type of sounds are heard in asthma? Here they have given stridor, wheezing, crackles, and pleural friction rib. See, what are stridor? Stridors are high pitched sounds. Stridors are high pitched sounds. They are heard when there is narrowing of upper respiratory tract. Stridors are the high pitched sounds. They are heard when there is narrowing of upper respiratory tract, that is pharynx, larynx, and trachea. When there is a narrowing of these parts, at that time we may hear this type of sounds, stridor. Then wheezing are also high pitched whistling sounds. We will whistle, no? Like that sounds are heard. Wheezing sounds are very common in bronchopneumonia. Wheezing sounds are very common in bronchopneumonia. In asthma, there will be bronchopneumonia. There will be narrowing of lower respiratory airways, that is bronchi and bronchioles. Bronchi and bronchioles. When bronchi and bronchioles get narrowed, they produce high pitched sounds. Those sounds are seen in asthma. They are wheezing sounds. Hence, wheezing is the correct answer. Then crackles. Crackles are the one type of clicking sounds, tuck sounds. They are heard when the alveoli are suddenly opened. These type of sounds are also heard in pneumonia, in pulmonary edema, etc. Then, and this is also a wrong answer. Then pleural friction rib, as name suggests, these sounds occurs due to rubbing of pleura, that is visual pleura and parietal pleura. These two layers are the protective layers of lungs. Think that these are lungs. Outside the lung, there are two bilayered layer, that is pleura, visceral and parietal layers. When these layers rub, they produce a sound called pleural rub. This type of sounds are not associated with narrowing of lower airways like seen in asthma. Hence, here the correct answer is wheezing. Wheezing are the high pitched whistling sounds heard when there is a narrowing of bronchi and bronchioles. Narrowing of bronchi and bronchioles is seen in asthma. Hence, this is the correct answer. Next MCQ is, the primary stimulus for breathing in a healthy individual is an increase in following which levels of these components stimulates the breathing in healthy individual? Oxygen levels, nitrogen levels, carbon dioxide levels, hemoglobin levels. See, human brain stimulates breathing when there is increase in the levels of carbon dioxide, that is PaCO2, partial pressure of carbon dioxide. When there is increase in partial pressure of carbon dioxide, brain stimulates the breathing. It doesn't stimulate to oxygen levels or to nitrogen levels or to hemoglobin levels. When there is increase in the levels of carbon dioxide, brain stimulates breathing. Brain sends impulses to increase the breathing. Hence, the correct answer is carbon dioxide levels. Next MCQ is, which medication is considered a rescue inhaler for a patient having an acute asthma attack? Means, following which medicine is more important for asthma attacks: salmeterol, albuterol, tiotropium, fluticasone. See, salbutamol or albuterol is the rescue inhaler drug for asthma patients because it is SABA drug. What is SABA? This is SABA drug. SABA stands for short acting beta antagonist. Short acting beta antagonist. Salbutamol is the short acting drug which starts to act in 5 to 10 minutes when inhaled. It starts to act in 5 to 10 minutes when inhaled. Hence, salbutamol is the life-saving drug in asthma patients. This is about 10 important MCQs which are asked in previous year question papers. Hope you understood. If you are new to my channel, please subscribe my channel. If you like this video, please share to someone who are needy. Thank you.